Hi, everyone. Welcome to our Wednesday webinar. We're waiting for a few more people to join, but we appreciate you joining us today. Oh, good. Make sure, let me disable the waiting room so somebody can get in here. There we go. Well, welcome everybody. Happy Wednesday. Welcome to our Wednesday webinar. We are going to dive in and just let people join the conversation as they get here, but thank you for joining us. And we look forward to diving in today with Community Spring and sharing, having them share what they're doing in our community. Before we get started, I have a couple announcements from the Community Foundation. And one thing I wanted to do was a quick poll. So I'm going to launch the poll and have you vote on the Community Foundation Philanthropy Hub. So how many of you have heard about the Philanthropy Hub of the Community Foundation, one of our new initiatives? So just mark if you've heard about it, if you need more information, or if your page, your profile is already set up. Oh my gosh. All right, give everybody a few more minutes to complete it. And then, all right, we'll do 5 more seconds. Perfect. All right. So I'm sharing the results now. It looks like 13% of you have not, 25 want more information. And then it looks like almost 60% of you already have your profiles up, which is awesome. We have 50 profiles up on our Philanthropy Hub. And so those of you that know, our Philanthropy Hub is our community's first online searchable database of nonprofits. So each nonprofit is able to create a database. Profile, and then that way it's searchable for funders to look and for you to really start sharing information about your organization. So we're partnering with GiveGab on that, who we work with on the Amazing Give. And so be ready for information soon because we want to get that out to the public and we want to make sure that your profiles are set up. So in the chat in a few minutes, we're actually having a training coming up on that, just a quick information session next Wednesday at 2 p.m. in our Wednesday webinar slot at 2 p.m. And so I will share that with you. We'll do a quick information session where you can ask me your questions. I can show you a profile and we can dive more in detail. So that'll be July 1st at 2 o'clock, and we will get that information out to all of you soon because we want to really do a big push to get the Philanthropy Hub out to our donors and to the community soon. So thank you all for sharing in my poll so we can really get started and push the Philanthropy Hub. So today, I'm so excited to welcome Community Spring. And I wanted to welcome, we have Lindsay, Kallman, and Tequila, McKnight with us from Community Springs. I'll pass it over to them. I will have everybody on mute, so if you want to unmute yourself and ask questions, feel free. And again, this webinar is recorded if you want to share it. And you can also use the chat today to answer questions. So I'm going to pass it over. Lindsay and Tequila.
Hi, I'm just sharing my screen. Give me 1 second here. Okay.
Hello, my name is Tequila McKnight. I am a fellow with Community Spring.
And I'm Lindsay Kallman. I am the Executive Director of Community Spring, and we are so excited to be here with you all today, sharing the results from our survey. These results are fresh off the press. We just finished the analysis. You are the first audience to hear any of these results, so this is really exciting. Also, I just want to acknowledge too that Zoom PowerPoints can be not as interactive as in-person ones, but we work with what we have. And I just want to sort of echo what Leslie said, that if you all have questions along the way, please feel free to unmute yourself and chime in.
We will be discussing the background and results of our Grassroots COVID-19 survey throughout this presentation. We will also be sharing anecdotes like this one here on the screen that came directly from the survey within this presentation. When we asked for examples of people supporting each other, one person wrote, "I have seen individuals reach out on their own to assist other people directly. It's a beautiful thing." Next slide. The background of Community Spring. Community Spring is a Gainesville-based nonprofit focusing on dismantling structural poverty and spurring economic mobility at a grassroots level. The twin pillars of our work are providing income and building power. We do this by hiring fellows who have been impacted by poverty to help solve systemic problems they identify as driving poverty in their communities. Up from left to right, this is Community Springs, Max Tipping, he's the policy director, Nadine Johnson, Latasha Brim, Kevin Scott, myself, Tequila McKnight, we're all fellows, and Lindsay Kallman, she's the executive director. Next screen, please.
And we just launched in January, so we're pretty new.
Why research COVID-19 impact? The inequities that we were feeling before got worse with COVID-19. We were hearing about issues from people in our networks that were not reflected in policy or relief. This is why grassroots response is key to our recovery efforts. We hope the results from this survey will be used to inform policy, philanthropy, and services, and show that the people closest to the problems are closest to the solutions. Next slide. Some of the methods that we used in outreaching of the survey, we did a video at Community Springs, and I'm going to play the video right now for you that we did to describing our process. The model we use to create and implement this survey is called Participatory Action Research. Participatory action research engages participants in the research topics, question framing, and translating the results into action. Our process. We collected information from the fellows about what was going on. We crafted questions to the community that captured what we were hearing. We vetted those questions with professional researchers. We outreach both in our communities and through paid ads via social media. We ran it for 2 weeks. Lindsay Kallman and Kevin Scott, a CS fellow, they analyzed the results. People experiencing poverty have been surveyed a lot without seeing a lot of change. No one likes to feel like they are under a microscope. This survey is different because our participants know who we are, why we are doing it, and trust us because we are part of the community. For example, I did a Facebook Live to outreach this survey, and within that day, it received 100+ responses to the survey because I'm a community member and I'm trusted in the community as well as Community Spring. Next slide. Next slide.
Yeah, sorry, I'm having a little. Whoop, whoop. Okay.
The survey participants, 247 people took the survey, but only 229 of those were eligible participants because they were not Alachua County residents. These numbers are representing 497 people sharing their income in Alachua County. We had representatives from all over Alachua County. Here we can see a heat map based on responses. The areas with the most representation was in downtown Gainesville, Northwest Gainesville, Southwest Gainesville, and Upper Northeast. Also representing and outlining areas such as Alachua, Archer, High Springs, Newberry, and Waldo. Next slide. Overcome of income of the participants. We had a pretty even distribution of income brackets with a heavy emphasis on lower income folks. We define low income as households making less than $50,000 per year. This is indicated in the pie chart as red and orange. Assuming a household size of 3, $50,000 per household is 80% of area median income. According to HUD, those households are considered low income. According to ALICE, which is what United Way uses to measure poverty for a household of 2 in Florida, is 44,200. Our determination of 50,000 per year per household is in between these two measurements. Next slide. Household size. We ask 2 different questions about this household size: shared income and shared physical space. We ask these in 2 different questions because multiple families in one physical household is common. For example, I have 2 grown daughters and they have kids, and we all live in the same household, but we do not share we don't share the income. And here's also a quote that someone put on the survey as an example as what people are facing in Alachua County. And what they wrote was, my son lost his job and has yet to receive his unemployment, which led him to apply for food stamps and move home with me. So the entire household is based off my income. And so the average physical household size among our participants is 2.6, and the average shared income household is 2.2 in Alachua County. Next slide.
I think too, if I just add to this a little bit, one of the reasons it's really important to think about these 2 different definitions of households is you can already see how people are slipping through the cracks. When you ask someone, you know, we're giving this benefit per household, but you have multiple households in the same address, are you defining household by shared income? Are you defining household by physical space? Because a lot of the time, these 2 definitions are not the same. I think it's just like important to think about in terms of how complicated people's lives are in the situation.
Right. We asked a question on the survey: if there was a $1 million fund for COVID-19 relief, what are the top 3 things it should be spent on? And as you can see, rent assistance was number 1. And you would think that's okay, that's good, because there are several programs such as GMV Cares Neighbors that assist with rent, but everyone will not qualify or be able to get through because they only take a certain amount of applicants. As we will later discuss, we anticipate this still being a greatest need even in July and August. Food was number 2 on that list, and also we will see later in the results, efforts thus far seem somewhat successful. The 3rd one was cash to individuals. This reflects a lot of what we are seeing in the results of this survey, but needs are so diverse. We will talk more later about this when we look more into people's indicated needs. These responses generally stayed the same when broken down by financial impact of COVID-19, with a couple of notable exceptions. Among respondents whose income did not change, mental health was ranked higher. And among people who lost 100% of their wages, cash directly to individuals were ranked higher. Next slide. The impact of COVID-19 on income. This is the most significant, compelling finding of our research. There is a direct relationship to income category and impact of COVID-19 on wages. We asked how many people's income changed in April and May, and the people who reported a lower annual income bracket also reported greater loss of wages due to COVID-19, as seen in the graph. Not shown in this graph is the analysis of people who lost 100% of wages. 26% of people making $20,000 lost all wages, while no one making $80,000 or more lost all their wages. The main conclusion of our analysis is the people impacted most by financial flux like the spike in unemployment caused by COVID-19 or any other crisis, are people who make less money overall. This is the meat and potatoes. Financial resilience is key to economic well-being and the prevention of future fallouts from a crisis like COVID-19. I'm going to turn it over to Ms. Lindsay right now to give us more details on the analysis of the survey. Thank you.
Awesome. Thanks, Tequila. So I want to piggyback off of what Tequila said in this last slide, because economic resilience is a really important part of this conversation. And so to measure economic resilience, we ask the question, how confident are you that you could come up with $400 if an unexpected expense arose in the next month? Now, we didn't make up that question. This is a well-vetted question that a lot of organizations use to measure economic resilience. We took it from a think tank that I know and love called the U.S. Partnership for Mobility from Poverty. And so I think that this is really important because when we look at COVID-19, it is not so different from any other crisis that someone in poverty might face. Losing your job, having a sick kid, getting in a car accident, having a hurricane come through. I mean, what we're talking about are economic shocks. And people with less money have less resilience to handle economic shocks. And this is really important because this explains why people experiencing poverty always have the feeling of, I can never get ahead. And that's because that's often true. People have a harder time building up long-term wealth when they start off with a low income and are just unable to handle the shocks of something like COVID-19. When we asked this question, 50% of people in the low income category said that they could not handle, they did not feel confident that they could come up with $400, where in the high income category, only 1% said that. And I think that's really significant to note and explains why this graph exists. When COVID-19 hit, it hit the people earning less the most, and it hit people earning more the least. So we see this reflected in our study, on our questions around employment as well. So overall, the people who answered questions about employment, about half of them were full-time. The other half was a combination of part-time work, independent contractor, retired, all these other categories, but about half of the respondents were full-time workers. 34% reported losing their jobs or reducing their hours. And this was not different across full-time versus part-time. It was just everyone who was impacted. So among people who lost their jobs or reduced their hours, and this gets into like really interesting findings, 44% were not confident they'd be able to return to their employment. So they lost their job, really unsure about whether or not they're ever going to go back to that place. 45% said they applied for unemployment, but only 21% actually received unemployment. And we asked why. For among the people who did not receive unemployment but applied, we asked why that was, and we got a variety of answers from the online system crashed to I was approved but never actually got funding. I mean, just a variety of things that just happen when a system's overloaded, which is what happens with our unemployment system, which is at this point, I think we're all familiar with that. In the qualitative responses, though, we got some really interesting findings there too. I think a big one being that the people who were looking for jobs before COVID, whether or not they were unemployed, maybe they were recent graduates, maybe they're independent contractors or freelancers, that group of people is really hurting. They already had job insecurity, and now they really have job insecurity because unemployment is high, and I didn't have a job before, so I'm definitely not having a job now. And so that was a real concern. Also, something that's worth noting is that COVID-19 had a big impact on people who had other sources of income that isn't always addressed in assistance packages. So for example, we had one respondent talk about how she no longer can get overtime anymore. And overtime is not something that unemployment would cover or an assistance packages cover, but overtime was a crucial part of how she paid her bills. She relied on getting overtime because the type of job she had, she could count on it, and now she can't. And the other group of people that was talked about a lot were people who depend on their dependents for employment or for income. So let's say you have a teenager living in your house and they have a job, and that teenager's wages are critical in paying the bills, but now that teenager is out of a job, and most assistance programs don't cover dependents' loss of wages. And so, but that's still a significant part of the overall household income. And then the other thing that we saw a lot when we asked about the qualitative responses for employment was just fear of COVID-19 and exposure in the workplace. And this has been a common thing that we've talked about, that the world is talking about right now, which is the people with the lower income jobs tend to be in the types of jobs that are exposed to COVID the most. That's people who work at restaurants. That's people who work in cleaning services. That's, I think that's overall just a fear of exposure. So this was a big one. We asked about if there were any bills that weren't covered as a result of COVID, and 30% of low-income respondents said they were unable to pay all their bills in April and May. And then the real critical piece of this was that then we asked, well, what wasn't covered? You weren't able to pay your bills. What bills weren't covered? And what we found was it was across the board. It was so diverse in people's needs and responses. Utilities was number one, credit card was number two though. And for credit card, that's just, now we're talking about accumulation of debt, right? Where you can't pay your credit card bill, that builds on itself. And you can see how this issue with economic resilience that we talked about earlier becomes a perpetuating problem. I already didn't have very much money. I had just enough to pay my bill. Now I lost my job. Now I can't pay my credit card bill. Now I'm collecting interest. And now all of a sudden I'm in debt. And so you can see how these needs are so diverse and how also they compound on each other. I think when you looked at sort of the other categories that aren't listed here, we had everything from student loans, car insurance, internet, other loans, furniture payments. So like when you have a payment plan of $10 down, $10 a month for the sofa, now what happens? I can't pay that $10 a month. And so it's really diverse needs and things that you wouldn't necessarily anticipate. So in terms of, we asked a lot about what kind of assistance people have had, and these responses were really surprising to me, actually. So 80% of people have gotten their stimulus check, which of course leaves 20% of people not receiving their stimulus check, which is, frankly, more than maybe I expected. Only 4% of total respondents said they received any other types of assistance. And this was the part that really surprised me, as I think I was expecting for the examples of what that assistance to be to include, some of the programs that I've heard and learned about, but actually the examples were more like mutual aid. They had someone say that the landlord waived the rent and that there was a lot of suspension of loans and that kind of thing, which I just thought was really interesting. And then of course, just to reiterate, only 21% of people who applied for unemployment actually received that assistance, which is kind of shocking. This quote I pulled out from the qualitative research that we did because I thought it was so telling. So this person writes, "I may have to go bankrupt. The virus and the restrictions may force me to lose everything. I understand the virus problem, but the government has failed us in helping the people. Too little, too late, if anything at all." And that really expresses like just how I think sad people are at this situation, and then also the response for it. So we asked several questions about housing, and housing is definitely a hot topic in Gainesville. So we definitely want to touch on that. So the overall takeaway from the questions around housing were that there were some issues in April and May, but that the real fallout for housing is yet to come. And I can definitely see that being true because as a lot of us know, the moratorium on eviction ends in July. And so here we have 24% of low-income respondents not able to pay their rent. Now, landlords are unable to evict them because of the moratorium. However, 7% of landlords still threatened or filed eviction, which is unfortunate since there's a moratorium. But the issue is that rent wasn't forgiven. Not saying that it should be, but that even those are moratorium on eviction, that 24% who was not able to pay their rent in May might not be able to pay their rent in July either, or August. We're not out of the weeds yet. This is still a journey that we're all collectively on. And I can see that this is going to continue to be a challenge. And I think housing is a big part of it. I mean, if 24% of our low-income respondents end up homeless because of this, I mean, that would be tragic. We already have a homeless crisis in this community, and we definitely don't want to be contributing to it more. I think that this quote from the qualitative questions was really telling. I mean, this person just basically right out said, April, May is the wrong question. I used what I had to pay those as a priority. It's June and especially July, that's the problem. And I think that like, that's, you know, you can talk about August too. I am concerned about what's to come, not what has already come to pass. So now we have a series of questions on sort of basic needs. The questions around internet and access to technology, you know, these questions are likely not a response from COVID. It's more so that in a post-COVID world, access to internet and technology is more crucial. And you know, especially when you're talking about opportunities for employment, when jobs are moving to a more remote setting, what does that mean for folks that don't have access to computers or access to internet? I mean, this is a real problem and sort of continuing to push people to the fringes. And so while only 18% of low-income respondents said that their internet didn't meet their needs, I think the important part is that internet is now more important, where maybe that 18% that didn't have internet before doesn't have internet now, but before they were able to find workarounds, and now it's becoming more problematic just because in a new virtual world, we rely on technology even more than we did before. So we also asked about food, and the results for food were, you know, 27% of low-income respondents said that they did not consistently have access to enough food in April or May. And when we looked at the reason why, the overwhelming response was that they didn't have enough money to buy food. Now, 27% is a pretty shocking number. Overall, for all the survey participants, it was around 14%, but among low income, that was 27%. This is really significant because you know, food ends up being the thing that people prioritize first. When you have a pot of money, the first thing that you're going to do is make sure that you can survive, and food is a first thing, you know, is the first thing that you make sure that you can, a need that you can satisfy. So the fact that 27% of respondents didn't consistently have enough food, I think is telling that there's still a major economic issue happening. I do think that number though, I mean, this is just Lindsay talking here, but not from the research, but I do think that number would be higher if not for some of the major food distribution efforts that have been happening in our community, which have been frankly impressive. And I think the main takeaway that I have here is that we need to keep doing it. You know, the food distribution sites need to maintain them, you know, they need to stay active. Food is still very much an issue. And I don't want to lose sight of that, because I think that as coronavirus continues, there's going to be a little bit of a fatigue. And I think food should not be one of the things that are phased out, but maybe thinking more creatively of how to make sure that people have the resources that they need. Okay, so for supplies, I'm going to turn it back over to Tequila.
For supplies, there was a very small amount of respondents on supplies. And at the time of the survey was a month ago, so that was an issue at that time. I think now that the stores are being replenished more with that, so I don't think that that's an issue at this time. So supplies, we didn't really get that many responses to that question. Next slide. Okay, and for education, 71 households that took our survey have kids in the household participating in virtual education. 50% of those children are in elementary school. Overall, 64% feel very or somewhat academically prepared for their children to start the new school year in the fall. But there is a serious relationship between poverty and academic preparedness, as you can see on the graph. And if you look on the graph, it's the orange is the low income and the purple is the high income. On the very unprepared, it's like 80% of low income that's not going to be prepared for this new school year because of the lack of the parents not being able to really help the kids. Next slide, please. I'm going to read a quote that someone put as a response on the education portion of the survey. They said, "In my opinion, the biggest hindrance was the parents and grandparents were totally unprepared for this. In most cases, it has been many years since they have had this type of work. Some of the work they have never had, the math. It was very frustrating not being able to help the kids." And so the guardians and parents are unprepared or unable to tutor and supervise. And the reasons that they stated were special needs, language barriers, juggling jobs, and the content that was outside of the parents' ability. So that's pretty high that those kids are not going to be, prepared this year, starting school because of low income and the COVID-19 crisis. Next slide, please. Incarceration, we didn't get a lot of results on that one as well. It was a small sample size, but we did get 13% of respondents, which is 30 people, are in regular contact with someone who is incarcerated in Florida. The vast majority of them are in Alachua County Jail awaiting trial and cannot afford bail, but would have a safe place to go if they were bailed out. They also said limited access to care packages. I don't know if you know what care packages are, but they're packages that people can purchase for their loved ones who are incarcerated that has like their food and hygienes. And so 41% said on the survey that they did not have access to those care packages because of COVID-19 crisis. Next slide. The well-being. When well-being was questioned on the survey, 40% of households report more tension in the household during the months of April and May than before COVID-19. 20% say more tension in the neighborhood than before COVID-19. 72% of respondents report feeling down, depressed, or hopeless. When asked, how often have you felt that there was no one you could turn to? There was a big difference along income lines. As you can see from the graph, this question can be interpreted in a lot of ways. Support network is less among low income respondents. When everyone around you is struggling, it can be hard to find the support that you need. It can also be a shame stigma attached, as well as even asking for help when you're broke. So I'm going to turn it back over again to Ms. Lindsay for the conclusion and the next steps. Thank you.
So, there's a lot that we can take out of this data and out of this research. There are a couple big ones that I just want to highlight here. The biggest one, it goes back to the conversation earlier about economic resilience. Those that were least able to bear the brunt were the hardest hit. And I think that's just really important when we think about funding priorities, when we think about services that we provide. It was really low-income folks that were hit the hardest. I think the other piece of this is that needs were so diverse. I mean, it's everything from utilities, rent, credit card, food. I mean, it really ran the gamut. And I think because while this was a medical crisis, it was an economic crisis as well. And so the needs are diverse. The other piece that I think was really important is the fact that this might just be the beginning. And I think that, seeing people's concerns about rent in July and August. Also, people talked a lot about how, GRU has been deferring payments, which is great, but those payments don't go away, which means that those bills are compiling. And I see that with a lot. I mean, there were several programs that people mentioned about loan deferrals and deferrals of payments, which once again is great, but those payments still need to be paid. And so that fallout is going to happen in a few months from now, or whenever it does go to collections. And I think similar with unemployment, we'll see how unemployment recovers from this, but I think this is just the beginning. And then the last piece that I want to highlight is how important it is to bring forward historically silenced voices in order to rebuild a more equitable community. I think one of the things that we learned from this survey is just how important it is to ask the people experiencing the issues what the problems are and what the solutions are. And this is reflected in one of the quotes that we got that I'll read for you now. Children and families trying their best to meet each other's needs at a time when it seems others don't understand our fears, needs, wants, and expectations. And I think that really highlights the frustration that some people are feeling. In terms of next steps, I think it's really important that we use this data to educate policymakers, funders, and service providers about what the impact looks like on the ground so that we can all better serve our community. And I think how that translates into policy is targeting low-income folks, as well as making sure that our responses are as flexible as possible, because needs are diverse and because lives are so complicated. And earlier when we talked about household size and all these different exceptions to the rules and the ways people are falling through the cracks, what I'm learning from this survey is, and just from our conversations with the community, I'm learning that there are so many people who have fallen through the cracks, and there are so many people who are still hurting. And I think the other big piece too is that we can't lose momentum in our response. As I mentioned earlier, the fatigue has set on. I know I'm feeling it too. But the truth is, I think this is just the beginning, and we need to keep up our efforts. I'm hoping that we can use this research for some deeper analysis according to issue area. And this is where I would really love to hear from you all as well. One of the things I've been thinking, especially since we're a new organization, we have reached out to some people in our network, but are looking to build more partnerships with service providers that can use this information. So, one example is we asked about zip code, and I think it would be really interesting to look at mental health according to zip code, or tension in the neighborhood according to zip code, or food security, or the things that the agencies that are working on those issues. I think we are happy to share our data set, happy to collaborate in whatever way we can to make sure that they have access to this information as well. And then on Community Spring's side of things, the way we have chosen to put this research into action is through a new program that we launched this past Friday called CS Direct. So CS Direct is a direct cash assistance program to SNAP recipients. And basically the idea being that as much as we can fundraise, we will directly distribute in increments of $300 to people who are on SNAP. And the reason that we chose SNAP is just because we needed a low barrier way to access people without having them jump through a lot of hoops in an extensive application to demonstrate need, and SNAP felt like an easy one. But with that being said, there are people who are going to slip through the cracks of this program as well. And so the more voices, the more energy, the better. So with that, thank you all so much for having us, but we would love to hear any questions or thoughts or ways that we can engage deeper with us. And with that, I will stop sharing my screen, but these are our contact information if you need them, or we encourage you to use them.
Lindsay, there's a couple questions in the chat.
Great. I heard today about food money assistance being automatically sent to families with school-age children who are either eligible for free reduced lunch or attending a school where everyone is eligible. Any thoughts on this? Any thoughts on how families who don't necessarily need this, but who receive it because of their school, could direct it to those in need? That is a great question. It feels, I don't know much about this program. This is really great to hear. I think that it sounds like that it's maybe additional SNAP benefits, additional food money. That seems like only a good idea. In terms of how families can redistribute it, I mean, without sounding like I'm plugging my own program too much, CS Direct does, we're pooling resources to redistribute them. But that's great. I would love to learn more, actually. I haven't heard about this program yet.
I have a couple questions that got sent to me as the host. Lindsay, can I read them?
Sure, please.
We have somebody asking, saying, sometimes that can be a hard sell for donors. How have your funders reacted to giving money directly? I assume they mean unrestricted cash, or how that works.
Yes. So that's a great question. And that's a question that I've heard a lot. That's, that's not uncommon. I think that there is a movement to reduce restrictions on assistance towards cash transfers. We are not the only ones doing this. We modeled our program after a group called Give Directly, who does this internationally and has had tons of evidence supporting the program internationally. But because of COVID-19, has started doing it domestically in select cities, and they've redistributed something like $100 million. I mean, like tons of money redistributed directly to people in increments of, I think, $1,000 per household. And what the research that's coming out of Give Directly says is that people spend the money according to their needs, which is frankly more efficient than through programs. And it's efficient both on the nonprofit side of things as well as for them, because they can pay off their credit card bill, which there are very few programs that pay off credit card bills. But then, you're sort of breaking that cycle then of debt as well. So that's a long way of saying, yes, that can be a hard push for donors. I think because there is a movement towards direct cash assistance, I am seeing donors come forward with more interest in that recently. I'm also seeing this as an opportunity for educating donors as well, because I think that in the process of educating donors about cash assistance, you're also humanizing the recipients in a way that I think is necessary. Any more questions?
We have another one that came in the chat. It's very long, so I'm trying to summarize it. But I think the gist of what they're trying to ask is, do you think some of them not having assistance is they didn't know where to find it? Did you survey at all about how people are finding services they might have received?
Ooh, that is a great question. And we did not ask that question. Hearing it now makes me wish that we had, because I think that is true. Tequila, do you have any thoughts about how people hear about assistance? Major forms of communication on that.
Probably through social media. That's where I get most information from. So, I mean, that's where I'm getting it from, social media. I haven't really heard of any kind of any help. So, or what's the place they can call? 411 or something?
211.
211, yeah.
I think also word of mouth seems like an important one. And, from the conversations that we've had to, I think sometimes people don't want to waste their time either. And so word of mouth and having someone vet for, well, like this worked for me is important. But it is hard. And I sympathize with that question because I think that was one of the major weaknesses of GND Cares for Neighbors too. I mean, that got underutilized. And I've had several conversations about that recently to sort of get to the bottom of why that was so underutilized. And the anecdotal responses I've been getting, at least, have been it wasn't open for long enough, it was burdensome to apply for, and also there just wasn't enough time for word of mouth to seep through to get to people who need it the most. This also, not to go too far on a tangent here, but this also comes back to my concerns about access to internet and technology. is because there is a major communication barrier of how we reach people and how we advertise for programs. And the less access to a technology, that as Tequila said, social media is a huge part of that. And if people don't have access to the internet, that's huge. That's a huge barrier, and that's a real problem.
There's a couple questions in the chat.
So one question is, all of these issues require strong government support. With major elections coming up immediately, it seems that policy education coupled with voter registration drives and candidate forums aimed at these issues are critical. Was organizations can we assist or partner with to do this? And what would your top policy changes be? Okay. So, yes, and yes. So I would say that in terms of what my top policy changes would be, one of our fellows, Kevin, is drafting a policy brief, really as we speak. Had a meeting with him this morning about it, to take the data that I presented to you all today to draft a policy brief that we will circulate. We're also hoping to do a more public presentation about this research to engage the city commission, the county commission, and because you're right, I think that it will require strong government support. I do hope the nonprofit sector are key leaders in executing on some of this work, but I think that that's true. I think it's a government issue as well. In terms of what organizations can we assist or partner with to do that, so one group that we have partnered with is FLIC, and I don't remember the acronym. Tequila, do you remember what FLIC stands for?
No.
But there's an organizer in Gainesville, a couple organizers in Gainesville who are real leaders in the voter registration realm. And I do think that's important. I think activating voters is really critical for a lot of reasons, but that's a big one. So we've partnered with FLIC on doing some of that work. There are some candidate forums coming up. I think that the Alachua County Labor Coalition is organizing a candidate forum. And I think participation in that is really helpful. And the more voices that we have to advocate for some of these things, the better. Yeah, top policy changes. That's such a hard one because I think at the end of the day, it's cash in people's hands. It's economic relief. I think that is the biggest one. And, you know, we are trying to kick that off with CS Direct, but, you know, we are not primarily a service provider. We're a grassroots advocacy organization that does do some services. And so, you know, we're hoping to stand this up, but I hope it can be a model for a larger scale cash transfer initiative. So another question, what are changes that can be made in getting information out about programs to people who need them most, who need the resources most? I think that's a similar question to what was asked earlier about sort of communication. I think that the most important piece about that is engaging with people earlier in the process. And so this is one of the things that, you know, this is Community Spring's model, is to, we employ people to work on the issues that they have direct experience with. And I think that how that can translate to other nonprofits is if you're building out an initiative, engage those community members earlier in the creation of them and the policy of them, in the distribution of them, and the outreach. And that's key. I mean, like Tequila said, we were looking for survey responses and doing all this outreach, and then Tequila does one Facebook Live to people on her network, and all of a sudden 100 people responded. I mean, that's power, right? That's real power. And I think that when you engage people in the community earlier on, then they have an invested interest seeing it being successful, and it will be more successful because you have their voices and you have their leadership. And I think that, and having people early on have an invested interest in the success is going to make it more successful.
I agree.
Any other questions?
While we're waiting for any more questions, Lindsay, can you tell us how we can follow your work, or anyone that wants to connect with you, or what's the best method?
Yes, so we have our website, which is csgnv.org. And we also, and actually, I would love, once we have our policy brief, I would love, as our first receivers of this information, I would love to be able to share it with you all. And so Leslie, maybe I can send it to you, and you can maybe distribute it to the callers today. But yes, our website, my email, lkallman@csgnv.org. We're also very active on Facebook, so encourage you to find us on Facebook, which thank you Community Foundation for linking our Facebook in your previous announcement. So those are all good ways to connect.
Great, thank you so much. We appreciate you both being with us. Thank you, Tequila. Thank you, Lindsay. And we look forward to connecting and watching what else you're doing. This was great. Well, thanks everybody else for joining us. And our next Wednesday webinar, we're going to take a break with the holidays coming up, and so the holiday coming up. So we are going to be having our next one on July 15th. On July 15th, we're going to be talking about lessons learned from COVID. It can be very interactive with everyone being able to share and talk. So please join us then. And of course, join us next Wednesday for our Philanthropy Hub information session. So thank you all, and we'll be in touch. Thanks, everyone.
Thank you so much.
Yeah. Thank you.